The carotid sinus and aortic arch receptors monitor the arterial circulation. Receptors are also located in the walls of the right and left atria at the entrance of the superior and inferior vena cava, and also internal carotid artery, just above the bifurcation of the common carotid into external and internal carotid branches. Distinct branch of the glossopharyngeal nerve, known as the carotid sinus nerve. The fibers from the aortic arch form a branch of the vagus nerve, the aortic depressor nerve. One of the major sources of excitatory input to sympathetic nerves controlling the vasculature is a group of neurons located near the plial surface of the medulla in the rostral ventrolateral medulla, RVL. The axons of RVLM neurons course dorsally and medially. Descend in the lateral column of the spinal cord to the thoracolumbar intermediolateral cell column. They contain PNMT, but glutamate is the excitatory transmitter that they secrete to activate preganglionic sympathetic neurons. The baroreceptors are stimulated by distension of the structures in which they are located, and so the discharge at an increased rate when the pressure in the carotid sinus and aortic arch rises. Their afferent fibers pass via the glossopharyngeal and vagus nerves to the medulla. These fibers mostly end in the nucleus tractus solitarius, NTS. The NTS now secretes excitatory neurotransmitter glutamate. This excitatory neurotransmitter glutamate secreted from the NTS now stimulates the caudal ventrolateral medulla and also the cardiac vagal centers. When the caudal ventrolateral medulla, that is CVLM, is stimulated, it secretes GABA. And these GABAergic projections now innervate the rostral ventrolateral medulla, RVLM. Before we have seen that the rostral ventrolateral medulla, it stimulates the sympathetic centers. So, if the caudal caudal ventrolateral medulla, it secretes GABA. What will happen? It will inhibit the rostral ventrolateral medulla. So, no more excitatory stimulus from the rostral ventrolateral medulla to the sympathetic centers. As a result, sympathetic discharges to the heart will decrease. Excitatory projections, as we have already told, they also extend from the NTS to the vagal motor neurons in the nucleus ambiguous and dorsal motor nucleus. In this way, increased baroreceptor discharge inhibits the tonic discharge of sympathetic nerves and excites the vagal innervation of the heart. So there is decrease in sympathetic discharge and increase in parasympathetic discharge to the heart. These neural changes produce vasodilation, venodilation, hypotension, bradycardia, and a decrease in cardiac output. So initially there was rise in blood pressure. What is the response we have got? There is a fall in blood pressure now. So this is again a negative feedback mechanism. When one carotid sinus is isolated and perfused and the other baroreceptors in firing is even more dramatic, with activity only occurring during systole. At these lower pressures, the overall firing rate is considerably decreased. Now we should know something about resetting of baroreceptors. In chronic hypertension, the baroreceptor mechanism is reset to maintain an elevated rather than a normal blood pressure.